Hello and welcome to the NDTV Dialogues, a conversation of ideas. These are interesting times in India, a change in political landscape, especially after Uttar Pradesh, a focus by the Prime Minister on a new India. Also his focus on new ways to tackle India's age-old problem of poverty. While India has lifted a record number of people out of poverty, we also have the largest number of poor people in the world in absolute numbers. How do we change this? Can we actually eradicate poverty? Will a universal basic income help? Are we a welfare state first? To debate all these ideas, whether we even have accurate estimates to decide how many people in India are poor, we've got a great panel on the show tonight. Abhijit Banerjee, a Ford Foundation International Professor of Economics. He's also Director of the Abdul Latif Jameel Poverty Action Lab at MIT. We're also joined by Meghnad Desai, Founder Chairman of the Meghnad Desai Academy of Economics, MP House of Lords. Rohini Somanathan, Professor of Economics at the Delhi School of Economics, and also Surjit Bhalla, Economist, Senior India Analyst at the Observatory Group. Thank you all very much for joining us. Professor Banerjee, we discussed some of the themes of the show in the introduction right now. You also have a new essay out in a book looking at poverty and inequality. When you look at the new India the Prime Minister is talking about, when you look at the many schemes, whether it's JAM, etc., all with the focus to eradicate poverty, what's your take on it?
Well, I think that it's not so much that there are new schemes. I think that right now, if I think of what JAM is trying to do, is to change the way those schemes are delivered. The schemes are not new. I mean, mostly thankfully, I think the government has focused on improving delivery rather than adding new schemes. I think that's one of the better things that the government has done. What I think is interesting and important is that there is recognition that many of these schemes go to people who don't need them, or don't go to the people who need them. And I think the idea, what the government is trying to push is this, create a kind of a highway for sending things to people. And I think there is some hope that with the use of Aadhaar, with the use of other IT means, we will be able to kind of clean up that act. I'm not saying that would be easy, or that it wouldn't have some consequences which could be damaging to some sets of people, but I do think that it is important that we take the idea that we are very poor at targeting things to the right people very seriously. So I think that's, in that way, I think the government has the right concept.
Do you think, Dr. Bhalla, if you can come in, a technology-driven way, a much more targeted way to address an age-old problem, but do you feel that also today what the Modi government is doing is fundamentally transforming, say, the welfare economics? You've described it also as the Professor Amartya Sen School of Welfare Economics, but it's a completely different political way of addressing this as well.
Well, no, it is different, and if you will, in the delivery. Abhijit is absolutely right. I mean, basically, what are the programs that we have? The major programs, though, on the books there will be about 1,000 of them, is the public distribution system of food grains, is the fertilizer distribution, and the food for work program, now called NREGA, or income for work program, now called NREGA. Now, all three of these programs have been there since the mid-60s or something. Perhaps even earlier as far as the PDS is concerned. These have been hugely inefficient programs. So before we get to the UBI, which I think is an interesting, and actually nobody, just for clarification, I don't think any serious economist is saying it should be for the entire population. It's a shorthand, universal, but you really mean targeted universal. So coming back to what the government is planning to do, is to deliver more to the poor for less expenditure by the state. It's very doable, and it is, if you will, the big difference between what Amartya Sen, though I imagine he would also approve of more efficient delivery, though from some of the debates that have occurred on Aadhaar and ways of delivering, I don't know, so you have to ask him. But it is a more efficient way of delivering to the poor. They get more and the state spends less. How can anybody lose from that?
But it's interesting because sometimes the debate is cast, Professor Somanathan, very much as PDS, NREGA, the villains of the piece, as it were, and we have to replace it in a completely different way, whether it could be UBI, just still at proposal stage, but looking at other ways of saying direct transfers. And you've raised important points about where do you actually look at it, whether a cash transfer can, say, be the replacement for a good government school or a good government hospital. What would your take be on that?
I don't think we have any evidence that we can actually do without government schools and prosper, or government hospitals and prosper. And part of the unfortunate side of this whole debate on cash versus kind is that both the cash and the kind are really transfers of marketable goods. And really the essential argument for the existence of government is to provide goods that can't be provided on the market. So I think we just haven't been taking the public good issue seriously enough. And so it's not about how much we spend on NREGA or the PDS, but it's really how much we're spending and how much energy and effort and money we're spending in trying to make goods that wouldn't otherwise get provided better. So, they've announced that the health budget is going to go up to 2.5%, and that to me was the biggest announcement, rather than saying we're going to up the budget on NREGA or the PDS or we're going to improve delivery, because ultimately people can buy those things, and what they really can't buy is good healthcare. There's a lot of information problems. What they really can't buy is studying in a diverse school. Those are things that I think we should focus on.
That's an interesting point. Lord Desai, you had said interestingly at a lecture some years ago that, of course, poverty can never be eradicated. Do you think India has done enough on fighting poverty? Do you think when we talk about looking at poverty and putting it at center stage as a political issue, and you've got a very different kind of politics currently in place, you've got a very different kind of thinking about it, whether it's looking at direct transfers as a better way to giving subsidies, whether it's looking about how much of this should be private, public, what is the government's role? What do you think the Modi government's actions so far on alleviating poverty have been, and how would you rate it?
Let me preface by saying, as this book says, there was a great golden age when we measured poverty very well. Thank you very much. But we didn't really criticize the economic policies which were lousy and increasing poverty, not removing poverty. So I think measuring poverty is important, but removing it is more important. Yes. And even if you do it with a lousy theory, it's better to remove poverty than have a good theory. And I think from that point of view, I think it's not so much the Modi government, but the changes which have happened in the horrible neoliberal era of Indian economy since 1991, which has provided the means. There are a variety of ways we can choose. The means are there. Now, the reason why I say poverty will never be eliminated, because as a country gets richer, it gets more ambitious in how much they want to give to the poorest. And so our poverty levels go up. Right? So, I mean, in a sense, that's a problem. But I think by and large, a direct cash transfer has always been my favorite. I was one of the first to propose it. And I think the poor know how to use money. Don't be wiser than them. Give them the money. Occasionally, you might have to give them public goods like health. But, don't give them free health in a lousy hospital. Give them a bit extra cash to go choose their own health care, because we have created a lot of entitlements with lousy public goods supply. So I think let the poor have some money, let it be directly given to them without interference, without middle sort of agents, and then go on improving the provision of direct cash transfer.
Professor Abhijit Banerjee, you can come in, because direct transfers, you said, are perhaps can be much more effective than the old way of giving subsidies in a sense. But when you look at, say, the midday meal experiment, which has shown very clearly that children have started going to school because of midday meals, and then of course the corollary benefits which come with that. How do you balance in that debate between, say, Professor Somanathan's view and Lord Desai's view?
Well, I think there's two separate issues there. One is whether or not there's a bunch of subsidies which exist for historical reasons, which were perhaps true then, but I don't even think there was any very good reason to have a fertilizer subsidy. Or I think the one that we haven't spoken about, which I really detest, is the one on rural power, which is, I think, the reason why the water table is getting decimated. People can pump out whatever water they want, and I think these subsidies are really doing damage. So if I had to go down the list, the point is not to oppose, removing all possible ways of social support and then and then sort of putting one payment in its place. That might well be the right thing to do. It may not be the right thing to do. I think that's a separate question from whether or not right now there are a bunch of subsidies which are doing just damage, which we could remove and would make everybody better off. Now, of course, there are political transition costs, because the fertilizer lobby, for example, loves the idea that there is such a thing as a fertilizer subsidy, and that one will obviously have to be confronted. So there are reasons why these haven't been removed.
But for instance, we do government hospitals or government schools, and where we again have data to prove that many people will go to private schools, where actually the poorest of the poor will take loans to send their children to private schools, so they feel government schools don't deliver quality education, or the same with government hospitals. Do you think there is an argument for saying that perhaps give the money, as Lord Meghna Desai says, and let them choose which hospital or school they should go to? Or does the state abdicate its responsibility then?
So I think that's an interesting question. I think that it's a difficult one, because I think that there are, in particular, it gets us into the weeds very fast. So I think there is, in healthcare, if you look at the usage, I've been working on this for many, many years. If you look at the healthcare usage, as you go higher up, the public facilities are more used. So if you go up to the district hospitals are always full. Where there is really, the public system is essentially collapsed is at the primary health care center and the sub-center level. So in some sense, and that's less true in Kerala, but if you think of North India, which is where I have my experience of healthcare is, it's really like these facilities are empty. Most of the time you go there, neither the doctor is there nor the patient, but there's someone there who's usually the janitor, and if somebody comes by, including the patient, the janitor prescribes medicines.
And it's all paid for by the great Indian taxpayer.
Yeah, exactly. So I think
barefoot doctor.
Exactly. Why not? But I think that there is, so in some sense, I think this question, I think to frame it as should we remove all public health care is, I think, framing it in the wrong way. I would say that there is certainly for example, if you are in an accident, you don't want to be taken to a private hospital. At that point, you'll die basically, because they will not take you because you don't have insurance. They don't know where you're from. The private hospitals are horrible,
exactly.
And so at that point, you are much better off being taken to the district hospital, where you will actually get someone to look at you.
Dr. Bhalla, you wanted to?
Yeah, no. Let's look at what our experience, India's experience. And nobody is arguing that there should be no government or no government spending, etc. I don't think any of us, including Meghna, is arguing that. It's how do you do it. So let's look at, I'll give you two examples of where we have done disastrously. Okay, so this is independent of whether you have cash transfers or not. There are two goods, if you will. One, the most classic public good, which is sanitation, which only the state, if you will, can efficiently provide. And we have done very little about it in our 70 years. Why this is, where if you look at Europe, you look at practically any other country, any other set of countries in the world, they have attacked this problem from the level of the state, which is why, if you will, they develop faster. Why in all of this, we have come out with schemes, economists have looked at it, and all kinds of people have analyzed it, etc. And yet, the most necessary public sector output is not there. Second, so they are both type 1 and type 2. Second error is college education. Why in the world, when all the 95% of the people who go to college, if you will, are upper class, who pay a lot more when they go to high school and then get free education? Why hasn't our system? We worry about primary, secondary, etc. Why do we do this? So independent of how you finance it, you do. If you were to do, if you will, the things that only a public sector can do, that's what the government should do. And for the rest, I think it should be cash transfers. Now, for emergencies, healthcare, etc., there are public hospitals, absolutely. But give the people a chance to choose. The whole approach for the last 60, 70 years has been in India and elsewhere, where a lot of the countries have started changing over the last 10, 15 years. The loco parentis, that the state knows best. And that is, if you will, the view that we have had, the mindset we've had, is the state is the only provider and they know best, no matter how inefficient and how ugly the state is in its enterprise to lower poverty.
Also, Professor Somanathan, and this bit has been raised also about measurement of poverty. The kind of haze there seems to be about how many poor people actually India has. I mean, when it came to the Food Security Act in the UPA time, it suddenly said 2/3 of India is poor. But when it comes to discussing policy making, when it comes to, say, budget lobbying, when it comes to aspects which are discussed, very often what's top of the mind is about what are the corporate exemptions that you can get, what are the other issues which are socio-political or sometimes religious in nature. These basic issues don't get political mainstream until it comes to discussing whether to remove a subsidy or not. So whether Manrega, which is dismissed by this government, now continues in a slightly different form. But that confusion seems to remain about how do we look at India? Are we fundamentally a poor country? Are we a country which is the brightest spark in the world economy? Do you think there's a dichotomy in how we look at India's poor and how we actually factor them into our mainstream discourse?
I think we have a lot of discussions on poverty. I don't think it's particularly neglected. I think it's mismeasured, and what it would take to measure it is not often discussed. And so this whole debate on private versus public, we don't factor in the public services people are getting anywhere. So when we measure poverty, we look at the national sample survey, we look at consumption expenditure. Now your consumption expenditure could be high because you're rich, but it could also be high because you don't have a public hospital or a public dispensary, and so you're really spending what someone else who has one wouldn't spend. Now we never factor that in. So when we're actually measuring poverty, we're doing it based on consumption. We should be basing it on income, and we never really think hard about what the difference between those two measures are. And so my problem is not that we talk a lot about a lot of things, including poverty. And so it's not the volume of debate on poverty, nor is it about the numbers of poor, because as Meghnad said, it just depends on what you consider poor. And they'll always be poor, and they should always be poor in the sense that you should be caring about people who don't have as much as other people. It's really, what does it take to measure things right? And having that debate with people who don't hold on to their positions, but who actually want to learn from the other side and say, look, you have a different position from what I do. There must be a reason why we disagree. Are there good reasons why we disagree? Do we agree on the fundamental goals that we share? And I think that's the kind of debate I would like. It's, on anything. And then if we don't discuss poverty, we'll discuss something else. But if we discuss it with that in mind, then we'll do a good job.
Poverty becomes a political selling point in a way, because you see politicians compete, whether the Prime Minister talks about his humble origins as a boy who sold tea, whether it's Lalu Prasad Yadav in Bihar who talk about how poor he was. I mean, every politician vies to say how poor they were, even though assets now may have changed completely once they're in politics. But in terms of actual, say, Rohini
how
said,
poor they were, not how poor they are.
So if that same get out of poor quick model was applied to most of India, do you think that in that sense, and I talked to us earlier about this whole dole economics, Manrega, and whether there's been a fundamental shift, many have said in that sense the Modi government hasn't changed much, that all governments in India, even the right wing, are actually just less left than the other.
You see, Modi government is not out of the sync of economic thinking of all political parties in India.
Right, so it's just
it is not a radical government in terms of economics. Modi loves the system. He wants to improve it, but he doesn't want to abolish it. You have to be absolutely clear. Whatever his view may be on the secular, whatever issue, on economics, RSS and CPM are not far apart.
Okay.
They hate business. They love the state. They love the state.
And
they love being paternalistic. They love wasting money under the state, and they don't really think the poor ought to be asked. Very paternalistic. Now, I think what we really need is to find within this constraint more efficient ways of curing poverty, because I don't think anything more radical will happen. So I think I say, okay, look at some subsidies critically and see if you have the political capital to be able to get rid of it.
LPG was one.
Especially the power subsidy, which has ruined the water table, and which is very important. At least maybe under the Paris Agreement, we can eliminate those subsidies.
But farm loan waivers. I mean, a political promise which has happened straight away.
The powerful lobbies always get subsidies. We haven't talked about corporate subsidies. We only talk about farmer subsidies. Subsidy. This country lives on subsidies. Everybody wants a subsidy, but important point is, within the political constraint, how do we get some extra money to those who are sort of more deserving? And so one of the things which happened in UK is Peter Townsend, who was a very famous poverty researcher, he conducted a survey of people saying, what do you think poverty is? What is the minimum people should have in their daily diet? And of course, it caused a lot of controversy, but the thing is, people have to know, in people's mind, what do the poor people not have? And base your poverty standard on that rather than on NSS data and consumption expenditure, because those data are never going to be good enough.
Do you support that argument, that farm loan waivers are perhaps, why is there so much inordinate attention on it when you look at, say, corporate subsidies? Do you think that that argument stands for farm loan waivers?